Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe my channel and also please give your valuable comments. So in this class, we will deal with the past history, importance of the past history and how to take the past history. And as you all know, in the last class we have discussed about the history of present illness, and we have seen the 10 important points that has to be inquired with the patient to get the maximum information about the main complaint. So that's all over. Now we come to the past history. Now when you take the past history, actually the past history should include all those events which happened prior to the present illness, but it should not be the prior presentation of the same illness. So what I mean to say is, as we know that while we are taking the present history, we usually ask one question: since how many days patient was apparently normal? Okay, although the symptoms are present since last 10 days, patient may say that I am having the similar type of illness since last 1 month. Now by last 10 days it is increased. Now this particular duration of 20 days, okay, so that should not be taken as past history, because the duration of this 20 days where the patient was feeling unwell, it is nothing but the continuation. It is the prior complaints of the same complaint which is existing now, and that may not be included under the past history. That means the total duration of a particular illness should not be confused with the history of past illness. Okay, suppose I will again give the example of the patient is having fever since last 10 days and for which he visited your hospital. But when you ask a question, since how many days patient was apparently normal, patient says that actually since last 1 month itself I am feeling some body pain and all those things and loss of appetite, etc. But still I was there in the home only. I didn't take any advice. But last 10 days onwards, I have started with the severe fever. Therefore, I consulted the physician. Now that prior 20 days where the patient has got some of the symptoms which was neglected by the patient, that is not past history, because that particular duration is also related to the present complaint only. So this mistake a student should not do while taking the past history. Okay, therefore past history include all those events which happened prior to the present illness, but it should not be the prior presentation of the same illness. Number one. Number two, in the past history you have to also ask about the previous surgeries, then previous hospitalizations, previous history of trauma, fall, and that should be considered. Okay, so what you have to take? The previous surgeries. Okay, for example, presently the child is having incontinence of the urine, and previously there is a history of a surgery of a meningomyelocele. Now this past history is very significant, because we know that the incontinence of the urine is actually because of the meningomyelocele, where the bladder emptying nerve or lumbosacral plexus has been injured, which is very common complication of a meningomyelocele. So now this past history has got so much of significance. Similarly, history of hospitalization. Suppose the patient has got similar type of illness previously for which he has get admitted. Repeated respiratory tract infection, lower respiratory tract infection. This is quite common in congenital cardiac disorders or any congenital problems which is existing in the upper or lower respiratory tract or GIT tract, etc. Usually it leads to recurrent respiratory tract infections, that to recurrent lower respiratory tract infection requiring hospitalization. So this history is very important. This past history is very important. History of trauma, okay, that may have got a later effect. So that should be always considered. This is one important point. Second point in the past history that you have to ask is previous history of long-standing fevers, or previous history of psychological illness, or previous history of untoward events, any history of epidemic or endemic exposure to epidemic or endemic disorders, or history of any nutritional disorders previously. So all these things are very important as far as the past history is concerned, because if the patient is having the history of nutritional disorders previously, there may be hundreds of causes for the nutritional problem. Okay, so for the present problem also may be related to that particular nutritional issue also. Similarly, endemic and as well as epidemic, because some of the epidemic disorders may have a long-term complications, okay, or history of torch infection, okay, that has got a long-term complication to the baby also later onwards, okay, psychological illness. So these are the important points that has to be asked in past history. Similarly, especially in children, the history of blood transfusion is very important, okay, especially the children, the congenital hemolytic anemias are quite common in children, so maybe thalassemia, sickle cell anemia and all those things. So therefore, history of previous blood transfusion gives a very good history, a clue to the diagnosis of the disease. History of previous blood transfusion and any untoward events during the time of the blood transfusion, and if there is a history of blood transfusion, in how many gaps, how many days of gap it was transfused, how many times it is transfused, this detail has to be taken. Similarly, there is a history of similar events, okay, same type of symptoms recurring. Suppose the patient has got vomiting, nausea, vomiting and abdominal pain, which is coming in a very cyclical manner. For example, for every 3 months he start with this, or every 15 days once he start with this type of vomiting and nausea, and then by keeping the patient nil by mouth, it will be completed, it will be corrected. Okay, so what it suggests, this suggests one or the other type of metabolic problems. Okay, so this is the nature of the metabolic problems, which comes in a cyclic way. Suppose after taking one of the protein, my body is not able to tolerate it. There is some inborn error of metabolism. Metabolism is not taking place. Then what happens? There is accumulation of the waste products of the improper metabolism, and that causes the different problems like acidosis and all those things, and that leads to vomiting. Okay, so then you admit the patient to the hospital. In the hospital, he will be kept nil by mouth, nil orally, as he has got vomiting. Once you keep the person nil by mouth for 1 or 2 days, the problem will be corrected because he is not taking anything. Okay, so then he will be discharged. When he come back to the home, again he start with a normal routine diet, and again the problem starts. So this type of presentation, if it is there or history is there, that has to be taken, because this suggests towards some of the inborn errors of metabolism. Okay. Similarly, history of allergy and food hypersensitivity, that is very important. History of allergy to dust or maybe mites or some other food products or some other dairy products, or sometime the milk products, okay, or dairy products, drugs. Okay, so this type of history of allergy has to be taken. Similarly, history of food intolerance should be also taken. Okay, or environmental allergies, so that has to be taken. So these are the important point in the past history. Further, history of traveling from one area to another area, or one state to another state, or one country to another country. This is also very important. Okay, so especially this nowadays, as the globally we are moving everywhere, so this type of history is very important. Okay, a person who is coming from the south to the north, he may have some problem related to the wheat intolerance, or what we say, the gluten hypersensitivity problems are more. Okay, or person going to the south, so he may have some of the problems. Okay, so the change in the area and or change in the state or change in the country, that is very important. We know that from the different countries, different disease transmitted elsewhere. Okay, similarly, suppose a person is moving from an endemic area to the other area, so he may bring that problem there. Okay, so history of traveling from one area to another has to be considered. Similarly, history of dewormation, this is also important in the children. As far as children, so antihelminthics or dewormation therapy, whether it is given or not, because worm infestation is quite common in children. Okay, so we know that it is one of the routine prescription whenever the patient comes to you, child comes to you. Okay, every 6 months usually we will go for dewormation. Then history of recurrent respiratory tract infection has to be asked. History of a recurrent urinary tract infection and history of any vitamin deficiencies. This has to be asked or inquired. Okay. Now the history of recurrent respiratory tract infection, I told that if there is a history of recurrent respiratory infection, it may be viral or it may be sometime allergic. Okay. If the viral we know that we have got the growth chart. Okay. If the allergic, then its own presentation will be there. History of urinary tract infection. This is quite important in children, because many times the undiagnosed fever in children may be because of urinary tract infection. Okay, pyelonephritis, etc. They are quite common. Okay, so therefore history of urinary tract infection has to be taken very seriously always. Okay, so burning, urination, micturition, etc. Then vitamin deficiency, history of vitamin deficiency, maybe there are some skin patches happening, or they are taking the fat contents very less, so that the fat soluble vitamins are not get absorbed properly, and then vitamin D deficiency leading to rickets. So to inquire all those things, so we have to also look into the vitamin deficiencies. So this has to be also asked. Now, history of growth fall and failure to thrive. This is also comes under the past history. Previously, whether the child has got growth fall, okay, growth chart has been get affected. Okay, see, always growth chart gives a very good indication, isn't it? So it helps to identify the disease very earlier itself. Okay, now just take the history, whether there is previously the physician who attended, he told the growth is falling, he is not gaining the weight properly, failure to thrive is there. So these are all comes under the past history. Now, history of long-term steroids. There are so many disorders in children where the steroid has been given, starting from nephrotic syndrome, thrombocytopenic purpurias, and so many other autoimmune disorders. So history of long-term steroids or history of anti-tubercular drug, because when there is a history of anti-tubercular drug, so for example, a child is coming with the arthritis now, and you didn't ask the history of this anti-tubercular drug. So then after asking, mother told that he has taken anti-tubercular drugs for 1.5 years, and now the present complaint of the patient is arthritis. Now see, this may be the adverse effect of anti-tubercular drug. Therefore, history of some of the long-term medication is also important. Of course, we will cover it in the treatment history also, but still you have to ask here. Then anti-hypertensive treatment or any some of the malignant drugs, that has to be taken. Then history of radiation or exposure to radiation or taking radiation. Then history of certain investigation. You have to also take some of the history, whether some of the any investigation has been done so far. For example, MRI, maybe CT scan or 2D echo, etc. So that itself also gives a clue to the diagnosis. When the 2D echo is done previously, then your focus will be there on the cardiovascular disorders. Okay, so this is one thing. Then history of sexually transmitted disorders. Okay, whether there is any history of sexually transmitted disorders, and that is also important. So these are the different important points that should be considered under the past history, especially for the children. In the adults, okay, there may be some points are not required, which is mentioned over here, or some other points may be required also. But for the children and pediatric age group, this much of history in the past history is very much important. Okay, so thank you very much for your patience listening. Again, don't forget to subscribe my channel, and also please give your valuable